Hello, and welcome to another edition of Orthopedic Sports Medicine Patient Educational Series with Dr. Adam Derhake. In this video, we're going to explore the postoperative rehabilitation following a labral repair of the shoulder. On the day of your procedure, an anesthesiologist will perform a peripheral nerve block on the shoulder. This is going to help out later on after the surgery with pain and symptoms once you go home. Even if your nerve block is working very well, I encourage patients to take their postoperative pain medication, one pill every 4 hours as soon as they get home, regardless of how much pain they're in. That way, once the nerve block wears off, you already have the pain medicine in your system. I usually recommend that patients ask the recovery room nurse when their last dose of pain medication was, and then they can start taking it 4 hours after that. This includes waking patients up every 4 hours overnight to give them a pain medication. Oftentimes the nerve block can wear off in the middle of the night. And if you have not taken a pain medicine all night, then the pain can come in a wave. Once the numbing medication of your nerve block wears off, I expect that your pain will go up. If at that time one pill every 4 hours isn't cutting it, you can increase the pain medication to a maximum dose of 2 pills every 4 hours during the first night following your procedure. I recommend you start with 1 pill, however, and only go to 2 pills if you think it is necessary. We will also give you a postoperative prescription for an anti-nausea medication called Zofran. Zofran is for the postoperative complications of nausea associated with the anesthetic. If you know you have a history of nausea following anesthesia, then I would highly recommend that you get the prescription filled and have it available at your house just in case. For patients that have had experience with surgery in the past and have not necessarily had a side effect of nausea, you may just keep the prescription at the pharmacy and pick it up only if you require it. On postoperative day number 1, you will return to my office so that we can change your dressing, go over your pictures from your surgery, review your sling, as well as to review what the process will be moving forward with the postoperative rehabilitation. Initially, you have a very large, bulky dressing on the shoulder that is removed on postoperative day number 1. We will go to simple little band-aids on the poke holes. At home, you can switch those band-aids out to waterproof band-aids and shower normally with the waterproof band-aids in place. It is also important on postoperative day number 1 that we review how to adjust your sling, how to take it off and on, and how to shower. For details on how to use your postoperative sling, please refer to my video on the shoulder immobilizer. Once all the big, bulky dressing is off of the shoulder, it'll be a lot easier and more effective to ice the shoulder. I encourage patients within the first week or 2 to ice the shoulder on a regular basis, as this will diminish pain and swelling and reduce the need for the postoperative pain medication. When icing the shoulder, you never want the ice to go directly on your skin. So always place the ice on the shoulder either over top of a t-shirt or a washcloth to protect the skin from damage. For the first month after your labral repair, you are in the sling 24 hours a day. The only time that you remove the sling is to shower. We will also have you learn some basic range of motion exercises of your elbow, wrist, and fingers that you will be performing on a daily basis. These exercises are also reviewed in the video on the postoperative sling. 2 weeks following the procedure, you return to my office to see my nurse practitioner to evaluate the condition of your wounds and to remove your postoperative stitches. At that time, my nurse practitioner will check on the range of motion of your elbow, wrist, and fingers and see how your overall pain is going. At that time, we'll also check that the sling is being worn appropriately and that you're not having any problems with your sling. At 1 month post-op, you return to the office to see me. At that time, we discuss removal of the sling and beginning informal outpatient physical therapy. It is not uncommon by 1 month post-op for you to have no pain in your shoulder. Once we get out of the sling and we start physical therapy, I do expect that the pain will go back up. Therefore, we often give you a lower dose pain medication as you start your physical therapy so that you can tolerate some of the exercises and stretches that you're doing with your physical therapist. Again, like your postoperative pain medicine, we do have you take it only as you need it at that time. Initially, physical therapy is just about basic passive range of motion exercises, meaning the physical therapist is going to be pushing and stretching the arm back out above your head, both out in front of your body as well as out to the side. Your therapist will also be working in a more gentle manner and stretching the shoulder going out away from your body and back behind your back. It is the external rotation, rotating out away from the body, that we want to go very slow with. Especially in patients that had a history of a shoulder dislocation, the labral repair is traditionally up in the front and in the bottom of the socket. Therefore, external rotation stretches will place the repair under the greatest amount of stress. My goal for patients is for them to have full passive elevation of the arm within the first 4 weeks of starting physical therapy. However, with external rotation, I want to go much slower. The goal for external rotation is that you get to 50% of your external rotation as compared to the other arm 6 weeks after starting physical therapy. At that point, I allow therapists to be a little more aggressive in doing your external rotation stretching. This is really the art of medicine and the art of taking care of labral repair patients, as we are trying to tighten up the shoulder to prevent any recurrent instability episodes while not allowing the shoulder to get too tight where you don't get all of your range of motion back. I do not want patients to get too aggressive, particularly with their external rotation stretches, too early within the rehab process. Otherwise, they're in danger of swinging the pendulum too far the other way and leading to increased risk of recurrent dislocation down the road. At 2 months post-op, patients return to my office so that we can recheck your range of motion and see how your initial month of therapy has gone. Ideally, your arm is able to be stretched all the way back out up above your head, but you're still experiencing some residual tightness at terminal degrees of external rotation. At that point, I do allow the physical therapist to start to be a little more aggressive in your external rotation stretches. As long as you continue to have some stiffness in the shoulder, I do expect patients to continue to have some pain or symptoms in the shoulder, particularly when they are doing their therapy exercises or their stretches. As your range of motion continues to improve with time, I expect your pain and symptoms to also resolve. At 2 months post-op, your physical therapist will also start adding additional strengthening exercises to the labral repair protocol. Initially, strengthening is done at or below shoulder level so as to minimize the amount of stress placed on your labral repair. In the office, we may have discussed the essential role that the rotator cuff plays in being able to provide dynamic stability to the joint. What that means is that if the shoulder is going to pop out of place, your rotator cuff can work to help reduce the tendency for the shoulder to pop out of place. Therefore, it is vitally important for patients to regain full strength around their shoulder joint with rotator cuff strengthening exercises in order to be able to effectively protect the shoulder from recurrent dislocation down the road. As your rehab continues, the physical therapist will add progressively more complex and sports-related strengthening exercises. For most of my patients going through a labral repair postoperative rehab program, they are not going to regain full strength in the arm until 4 to 6 months following the procedure. Patients must be able to demonstrate that they have regained all of the strength of the shoulder and that that strength is equal to their other arm before we even discuss return to sport. Return to sport with patients that are recovering following their labral repair can vary depending on the type of activity or the type of sports that patients want to return to. Whereas some of my athletes, such as track and field or cross-country athletes, as well as my golfers or my soccer players, I may allow them to return to sport as early as 4 months after their labral repair. However, other athletes, such as overhead throwing athletes in their dominant arm, or athletes participating in contact sports such as football, may need up to 9 to 12 months after the procedure to be safe to return to sport. In the end, the process of clearing an athlete to return to sport without restriction is a very individual decision. This decision is a multifactorial decision based on the patient's extent of their labral injury, the instability of the shoulder preoperatively, as well as the patient's course through their rehab program, or the level or intensity of the sport that they intend to return to. Although I do recommend that my contact athletes, such as football players, wear a postoperative brace when they return to sport to help reduce the risk of recurrent dislocations, the grand majority of patients following a labral repair do not require any bracing to return to sport. As with all of my athletes, I remind my athletes that even though I may medically clear them to return to their sport, it may be a number of months beyond that before they are participating at a level that they were preoperatively or that they or their coaching staff expect them to be at. I hope this video has helped you to better understand the postoperative rehabilitation following a labral repair and what you can expect as you're trying to return to your sport. Even though taking this time out of sports can be a difficult decision for athletes, ultimately, athletes gain additional confidence in their arm knowing that their labrum has been fixed and that their shoulder has been stabilized. I hope you enjoyed this video. Have a good day.